Hi, my name is Kristen Wilson, and I am co-owner of Action Potential Physical Therapy. And in today's presentation, we're going to talk about the pelvic floor, which is a topic that, as a woman, I hold very near and dear to my heart, but certainly has information that's pertinent for all people, men and women, since it is such a critical piece of our body. In today's presentation, we're going to talk about what the pelvic floor is, and then talk about some statistics about pelvic floor dysfunction, since this is an issue that affects so many people in our country. We'll also look at the causes and types of pelvic pain and incontinence, and talk about how we can treat each of those conditions through physical therapy. And lastly, we'll identify ways to prevent pelvic floor issues from happening so that you can best support your body and maintain healthy habits for your pelvic floor. Certainly, this is something, like I said, that I hold near and dear to my heart as a woman and also as a mother of 3 kids. There is a huge shift in the way that we are managing pelvic conditions because the OBGYN community has supported physical therapy in starting to educate people as to why pelvic health is so critical. We want to make sure that after childbirth, we're able to help the body get back to its normal, natural position. In addition, anyone who has gone through any type of abdominal surgery or a prostate surgery, you will have some ramifications on the pelvic floor. And our goal is to help spread the word that there is help available and that the symptoms that come from pelvic floor dysfunction do not need to go unaddressed. So let's talk first about what the pelvic floor is. So the pelvic floor is a sling of muscles. It lies between the 2 pelvic bones, and its job is threefold. It is supposed to support the organs in the body to keep them inside the body. It helps to control bowel and bladder function by controlling the orifices that leave the body. And it also contributes to sexual dysfunction or sexual function and childbirth. The interesting thing about the pelvic floor is it acts as a mirror to the diaphragm. So the diaphragm sits below the rib cage and the pelvic floor sits between the pelvic bones. And the 2 of them work together to maintain tension within the abdominal cavity. So these muscles have to work in synchronicity so that they can continue to support all of the functions of the core and the body. The interesting fact is that there are about 24% of all Americans who have pelvic floor dysfunction. And that number is often grossly underreported because many people don't like to talk about their pelvic floor problems like pain or incontinence. So, a quarter of people are brave enough to say that they have an issue, but I anticipate that that number is actually quite a bit higher. So what causes pelvic floor problems? So we talked already about childbirth. Certainly, having a baby grow inside you stretches the abdominal muscles, and then delivering a baby, whether it is cesarean or vaginal, is going to have a very strong effect on the pelvic floor and abdominal cavity. So childbirth is one of the key causes for pelvic floor dysfunction. Other issues that might contribute to problems in that area include abdominal or pelvic surgery, certainly cancer, any type of tumor in that area, or cancer treatment in that area. Pronounced obesity will affect the pelvic floor, poor postural control or an abnormal diaphragm use. And then lastly, forceful or excessive exercise. So for example, people who are long distance runners may have pelvic floor dysfunction, or power lifters have a high rate of pelvic floor dysfunction because of the force and repetition that is going through their body. There are a couple main types of pelvic floor dysfunction, which we'll talk about here. The first being incontinence. So incontinence is losing your urine, and that can happen in a stressful situation like exerting or coughing, sneezing, laughing, running, jumping. And this is when the pelvic floor can't hold the urine into the body because it loses its ability to control the sphincter. The other type of incontinence isn't actually losing your urine, but it's a sensation of feeling like you're going to lose your urine, also referred to as urgency. So this is that frequent desire to have to go to the bathroom. And not only is it frequent, but it's urgent, where you have to almost rush to get to the bathroom. This is caused by an abnormal reflex being sent from the spinal cord to the bladder into the pelvic floor that's sending a message to your brain saying, go to the bathroom, go to the bathroom, go to the bathroom, even if you don't actually have to go to the bathroom. So this isn't necessarily a muscle problem, but more a signal problem. And then certainly there's a combination of both, where you can have both a loss of urine as well as that sensation of urgency. And this is called mixed incontinence. So you see here by the numbers, this affects a large number of people, with the most people experiencing stress incontinence, and the second most experiencing both forms of incontinence. A second pelvic floor dysfunction is called prolapse. We talked about how the pelvic floor is responsible for holding the organs into the body. Prolapse is when those organs start to descend down through either the vagina or the rectum and begin to work their way towards exiting the body. This is caused by a weakness in the muscles of the pelvic floor, as well as a flexibility in the ligaments that support those organs in the body. And this can be caused by a variety of those other conditions we previously discussed. There's three main types of pelvic floor prolapse that we see in therapy, and that is through the vagina, the rectum, or when the uterus starts to descend down through the vaginal opening. And certainly if left unaddressed, this can progress to where an organ is actually extending outside of the body. The way that we would address this through therapy is by helping to build the strength of the pelvic floor so that you can help to support those organs and prevent the symptom of either vaginal or rectal fullness that you can often feel when prolapse is present. Certainly, if the organs continue to descend and begin to exit the body, then that needs to be addressed from a surgical perspective. So the therapy piece is to try and prevent that surgery. Pelvic floor pain is another type of pelvic floor dysfunction that affects many people. These are a bunch of really fancy words that essentially mean pain in and around the vagina or the pelvic floor or tailbone. That pain can be noticed with things like sexual intercourse, putting in a tampon, having a medical examination of the vaginal area, or just at rest with things like running, exercise, sitting, or standing. So if you find that you're experiencing pain in and around the abdominal or pelvic area or the opening of the vagina or anus, I would really advise you to seek a physical therapist to help manage that pain and provide you with strategies. We would address that in physical therapy by providing some relaxation to those muscles that are causing the pain through either massage or the use of other tools. So pelvic floor dysfunction is treated in a variety of different ways through physical therapy. Certainly, there are other ways to control pelvic floor dysfunction, like medications, injections, and surgery. However, we try to approach this with a very conservative method first to keep the body free from all of those outside interventions. Physical therapy is a very safe way to address pelvic floor dysfunction and is a very hands-on approach that requires great trust between the patient and the provider. Certainly, we've had excellent results with alleviating all of those pelvic floor dysfunctions we discussed by working collaboratively with the patient to help work towards their goals. Specifically for pelvic physical therapy, in order to get the best picture of what's happening at the pelvic floor, we start with an internal examination. And this allows us to assess the muscles and the ligaments to determine what type of therapy is going to be necessary. Once we do that internal examination, we can decide if we need to work on strengthening or stretching the muscles, and that can be done both internally and externally. We might work on things like behavior modification or bladder training to help improve how your body is managing those pelvic symptoms. We can certainly work on improving the strength of your core and your hips and back, because those muscles are going to help further support the pelvic floor. And then lastly, we can use a variety of different tools. You see here pictured vaginal dilators or trainers. We also have pelvic wands, and then we also use what's known as biofeedback. This is using an electrical stimulation machine to perceive the muscle activity of your pelvic floor so that you can watch that muscle activity on the screen of the computer to see how well your pelvic floor is functioning. So we have tons of different tricks and tips for how to manage these symptoms. But most importantly, we also want to provide a lot of education to our patients and to the community on how to prevent these issues from even coming in the first place. So the first thing when considering your pelvic health is to make sure that you have a great diet full of healthy, nutritious, and natural products, as well as that you consume plenty of water. Hydration is a key for helping our body to be able to flush out toxins and maintain its homeostasis. We also want to encourage our patients to have healthy voiding patterns, which means going to the bathroom. Making sure that you're not going to the bathroom just because or just in case, and really listening to your body to understand when is the appropriate time for you to go to the bathroom. When you actually go to use the restroom, we want to make sure that you're not straining or pressing hard to either have a bowel movement or urination. And what we can do is train you on techniques to help minimize that straining, which can cause a lot of damage to the area. Also, staying active is going to be really helpful for the pelvic floor, as this is going to help to increase the strength of the muscles, as well as maintain your overall physical health and reduce obesity. So staying active is a beautiful way for you to keep your body healthy, both inside and outside. And then lastly, understanding that if you have incontinence, pain, prolapse, or a sensation of fullness, please seek someone out to help you manage those symptoms. A pelvic health physical therapist is the key to helping you maintain and improve your pelvic situation so that those symptoms don't continue to worsen throughout your life. We are really proactive in trying to get the word out so that people don't have to continue to listen when someone says, oh, that's just because you're a woman, or that's just because you had your prostate out, or that's just because you had a baby. Those aren't excuses for us. So we want to make sure that we can get the word out and provide people with as much help as possible. So in conclusion, pelvic pain and incontinence both can be fixed and prevented. So if you have those symptoms, seek someone out to help you. Don't live your life bathroom to bathroom. There's a way that we can help improve your quality of life and make this not an issue. And lastly, like I said before, just because you're a woman doesn't mean you have to deal with pelvic issues. Find someone who can help you work towards your goals to help build the best version of yourself. As a thank you for listening, please check out our free pelvic floor exercise guide, which is available here at reachyours.com/pelvic. While you're on the website, if you're interested in a free consultation regarding your pelvic floor, please fill out a request an appointment link, and we will happily connect you with one of our pelvic floor physical therapists to answer any questions. Thank you so much for your time, and certainly reach out with any questions. We're here to help any way that we can.